You know, knowing your family's medical history is very important. And get this, Thanksgiving is actually Family Medical History Day. So what better time than now to talk about it? And joining us to talk about the importance of having these conversations, we've got Scott Itano, family medicine doctor at Kaiser Permanente, Northgate Medical Center. Welcome back.
Thanks for having me back, Carly.
Always. So let's kind of start off with the basics here. What are the reasons it's important to know your family's health history?
Absolutely. In my 15 years as a family medicine doctor, I know when it comes to health, it's about nature and nurture. Nature being your genetics and family history. For example, if I have a healthy 25-year-old marathoner, no symptoms, I wouldn't screen him early for heart disease. But if I know his family history and his dad has a history of heart attacks in his 30s, I'm absolutely going to screen that patient for early heart disease. And that's the power of family medical history.
Yeah, it helps your doctor help you.
You bet.
So let's talk about Thanksgiving and why do you think this is a good time to really open up and have these conversations with your family?
Sure. Thanksgiving is the perfect time to have these conversations because you have multiple generations. You got siblings, parents, grandparents, and this is a great time to get all that family medical history in one fell swoop.
Yeah. What tips do you have? Because I mean, it might kind of just seem out of the blue, right? When you're bringing it up to your family. What tips do you have for how people can actually bring this up with their families, talking about their family medical history at dinner?
You're right. It may not be comfortable for most people. And so there's some conversation starters that people can use. Just saying, how is your health doing lately? Or why do you go see the doctor? And if that's still hard for people to do, and I get, throw your doctor under the bus. Just say, hey, my doctor, they're asking for this information. Would you be willing to have a conversation about it?
Okay, that sounds good. Do you think you should do it at dinner or before or after?
Depends on how much turkey and wine you're having. Depends on a lot of things.
I feel like I would do it early in the day when everyone's kind of hanging out around. You don't want to bring down the conversation at dinner, but I feel like talking about it when you're all together on this day would be perfect. Now, what type of information specifically should people include in their health history?
Absolutely. As a doctor, I want to know about specific serious chronic conditions, things like cancer, heart attacks, diabetes, high blood pressure, or conditions that run in the family, the same cancer that multiple family members have.
And in terms of which family members you should be looking at, is it just parents and grandparents? Is it also aunts and uncles, cousins? How far kind of out in the family tree are we going?
I love that question. For me, first-degree family members are most important, so siblings and parents. Then you can get to second-degree family members, things like cousins, aunts, grandparents, but it's critical to get those immediate family members.
Okay, and then what if somebody is not able to get that information that is being asked of them?
This happens all the time. Some people just don't know their family medical history. Others, they're adopted. And the most important thing is just tell me that. So as your doctor, I'll figure out, what to do with that information and create a plan for you.
I love that. And then what else would you say people should know when it comes to knowing their health history?
The most important takeaway is knowledge is power. Just have the conversation, get that family medical history, and then share it with your regular doctor, and that's the best way to stay healthy.
Is there anything specific as a doctor that, as soon as you see something or hear something from one of your patients, your ears perk up and you're we need to do something with that information?
Absolutely. Whenever I hear chronic conditions that pop up at an early age, anything before 50, I'm oh, I need to be thinking about this when it comes to your health history and maybe screen for those things earlier.
Yeah. In terms of keeping track of family health history, I know my sister actually is amazing. She started a Google Doc called Family Health History, and she just shared it with each of my siblings. How would you recommend kind of keeping track of that? Because I know every time I go to a new doctor, I'll have to look it up and text my mom and ask her. But is there a specific way you'd recommend your patients kind of keep track of that?
I love that. Just keeping a family tree. Some people do that, and you can write their health history along with that family tree. Or a lot of times, I'll keep that information in your health portal on the electronic medical record.
That's awesome. Scott, thank you so much for being here. This was a really important chat.
Thanks for having me, Carly.
Yeah, we'll see you again soon.
Absolutely.
And if you want some more information about Kaiser Permanente, you can find that on fox13seattle.com/Studio 13 Live.